I'm Dr. Norman Shealy, and I want to show you my new book. In one respect, of all the 34 books that I've written, this is the most important, because it gives you the outline of health that you need in today's world. The question is, why holistic medicine? Well, I began thinking in the mid-60s, there's something wrong. We are damaging more people than we're helping, especially those with chronic illness. And I began looking at what was happening with back pain, with depression, with anxiety, with heart disease, and many other chronic conditions. Now, I admit conventional medicine is good for acute illness. If you get a broken leg, you don't treat it with massage and herb tea. You need a competent orthopedist. If you have an acute bacterial meningitis, you need antibiotics. And there are other situations where that's true. If you have acute diabetes, you need medical treatment. If you have congestive heart failure, you need conventional medicine. But if the conventional medicine does not bring you back to total health within a maximum of 4 weeks, the time has come to begin looking holistically. There are not very many holistic physicians in this country, unfortunately. In fact, when I introduced the concept of holistic medicine in 1978 with the founding of the American Holistic Medical Association, the American Medical Association refused to allow ads for holistic medicine. And since that time, conventional medicine has tried to get rid of the term holistic by calling it complementary, alternative, integrative, everything but holistic. Well, holistic is the only one that is completely everything you need: body, mind, spirit. It covers you from top to bottom, and even in many acute illnesses it can be used, although the holistic physician needs to decide about conventional drugs, etc. There's a place for surgery, obviously, as well. But again, in chronic situations, surgery is rarely useful, and drugs most often make things worse instead of curing them or making them better. So what does holistic really mean? It means you look at the body. I mean, that's the foundation for, well, a complete evaluation by a physician who can examine the body and determine if there's something physically wrong. Of course, there's a history, and the history must include a whole bunch of things. Everything in your life that's important to health. All of the symptoms that you've had. And what I've found is that people with chronic problems have lots of symptoms. My average patient, 49 symptoms. Anything 20 and above means a lot of stress. And I have found that one of the foundations for disease is too much stress, too much chemical stress, too much physical inactivity, too much emotional stress. So you need to look at the complete picture of those things. And then who are you? You're not just a person with a body. You have a soul, a spirit. And ultimately, it is the spiritual part that is often out of balance. If your ideals are not being met in your habits and your life, then you have stress. Now, if you live your life with the wrong food, too much food, inadequate vitamins and minerals, you're going to get sick sooner or later. Most illnesses come on gradually, although they can precipitously come on sometimes when you sort of cross a certain point of stress. The important thing is to handle the whole picture. So I need to know, in working with a person, everything that I can find out. I actually have them fill out 3 forms that would take a minimum of half an hour more time in the office so that I could spend a full hour with a new patient. This idea of seeing a patient in 7 to 15 minutes is ridiculous. It's not possible except in the emergency room to make a good diagnosis even in 15 minutes. You need to talk to the patient. You need to evaluate the total stress. You need to look at, are they depressed? Are they anxious? What is the major problem that is driving them to see you or to have problems that bring them to you? This book outlines my work over the last 44 years. It gives you a way to make a decision for yourself when the time has come to look for a truly holistic physician who can assist you in integrating body, mind, and soul, because that is the purpose of holistic medicine.